The other day, I had gone for shopping with my mom. Girls, don't raise your eyebrows. I'm a good son. I go for shopping with my mom. Also, a good potential future husband if you're looking for one. So I had gone with her, and she did something that she knows irritates me to no end. She introduced me to the shopkeeper as Dr. Mustafa. And looking at me, he was quite surprised and he asked, "Kaun se doctor? What kind of doctor?" And I was again faced with this question that I still don't have an answer to. After 6 years of whole hard work, it'll take me at least 3 more years to give a suitable reply. How long will I remain a student? It's a question that haunts all of us. And it is also a question that gets answered today. Well, at least partly it does. Respected dignitaries, my dear friends, and most important of all, the special people for the day, our lovely parents. My heartiest welcome to you all. I can feel my heart racing now. I must have taken that beta blocker before coming here. So guys, we were a bunch of 200 aspiring doctors with every kind of diversity woven together by fate as the batch of 2010. We were a mosaic by all means. Some of us were declared doctors by our parents the day we were born. Some of us did not know where we belonged. And some of us worked really hard against real odds to get the fight up here. We are now, of course, much older than when we entered, and our personalities have evolved, and we have become a complex web of relationships between us. We have groups and friendly gangs and WhatsApp groups and groups within groups. How did all of this come to be? I'm sure each one of you will have your own unique story about it. Friends, do you remember the excitement with which the very first time you wore the white coat? And how can we forget the first day when we were introduced to a new companion for one whole year, the cadaver in the dissection hall? We literally shocked our friends in the electrophysiology labs, and being the nice, docile juniors, we completed not just our records, but also records of our seniors. I'm pretty sure all of us would love to get back to the sincerity of first year. From then on, of course, life moved on. We moved on from our teenage and became mature adults. And by that, I mean we had lagging attendance, haywire marks, bunking classes, interactions with juniors, long trips, and well, the honeymoon of MBBS. The North India tour, the official visit to the Pulse Fest of Ames, forged bonds between people who till the day before were almost strangers. Some of the bonds will last a lifetime. And by lifetime, I mean it. Some of us had our first lessons of love, others had breakups. I'm sure all of us have our own guesses as to how many of married couples will emerge from this crowd here. What's your pick? 6? 9? I'll leave that to the gossip kings and queens to figure out. There are so many things, friends, in the past 6 years that we will probably never experience again. Face it, guys and girls, a lot of it, possibly never again. The confessions on Facebook, the birthday parties at college, in the dining hall and beyond, mastering the fine art of giving proxies, learning the signatures of at least 5 other classmates, excelling at getting away with internals with the best of technology. I can see some naughty smiles there, so let's leave that. Sneaking into the lecture in the last 5 minutes, sneaking out of the hostel for a late night biryani, magically mastering subjects just a few weeks before exams, and also magically forgetting them soon after. We have been through all of it. Heck, we all got so used to studying such huge books that we were wondering if we could memorize all our relatives' names with mnemonics today. I remember this distinctly, friends. The first thing we all experienced in our hospital postings is random patients walking up to us and asking us for directions, and then giving us those looks when we were more lost than they were. I cursed my apron every single time that happened. We spent days just figuring out the hospitals. We walked the wards like we were lost, while some of the sincere students were lost in taking case histories. In the psychiatry posting, we wondered if that's where we actually belonged, given the fact that so many diagnoses fit us and our friends. In fact, I can't forget the spot diagnosis our psychiatry professor made within minutes of meeting me, and I'm yet to prove him wrong. 20, 30 people huddling around the professor, hovering over the same patient, and after the professor leaves, trying to elicit the same signs till we got them right or till the patient got angry and shouted, whichever came first. Jumping from one unit to another, one class to the next, in the hope of making at least some use of waking up early in the morning and traveling in the hot sun. All in all, I'm sure, friends, the biggest skill we learned through all of postings is standing. Standing till the end of times. The fests every year made athletes out of people who never knew they were. And organizing the fest in Osmania by ourselves was an experience in itself. Through the years, we ended up becoming more than just doctors. Along the way, we became event managers, protesters, leaders, sportspersons, speakers, and of course, not to forget, excellent essay writers on any topic under the sun. Lymphosarcoma of the intestine, you will have a 6-page answer. Unifocal granulomatous glaucoma, you will have 2 pages, that's fine. Never mind if these aren't even real diseases. We have certainly made our professors laugh a lot and then even cry. A big reason why we are here is the secret support from the lab staff in the practicals, the answers our PGs lip-synced in our vivas, and of course the generosity of our professors. And I'll be at fault if I don't highlight the timely and repeated guidance by our mentors. We can't thank every one of them enough. Also a word about NTR University. They tested our patients to the limit and delivered results that gave us dehydration from chronic bilateral lacrimal hypersecretion. And parents, us crying like babies after the results. But we know today that it doesn't matter what marks we scored or how many medals we bagged. Even the ones who finished last are doctors for life. And with effort, mind and heart in the right place, even we will turn out to be exemplary physicians, perhaps even better than the toppers of today. Internship lessons, what a time that was. We learnt new languages, some of us Hindi and some Telugu, but most important of all, we learnt the very significant language of medicine, by which I mean saying sabko hota PCM Rantak khalo and review after 1 week. Next. Well, this is what we did and learned. We are lucky to have been medicos in the tech age. I surprisingly learned the art of surgical staples before the art of suturing itself. And some of us surprisingly worked so hard that we welcomed hepatitis B and HIV into our bloods. And a handful of us even took prophylactic medications for it. And I don't know how many doctors welcomed numerous tuberculous bacilli in their lungs as a new home. In obstetrics, we literally had water break all over us. And in pediatrics, well, let me not say the variety of fluids. We also saw how poorly equipped the rural sub-centers were. Some of us even got a chance to do an entire surgery by ourselves with the PG assisting us. That's an unforgettable experience. I will always recall Bakappa, my first surgical patient. We were sheltered throughout internship by our wonderful PGs and professors. Every mistake we made was covered and corrected by them. And right now, for these PG exams that haunt us, you know you have worked really hard when your mom asks you at night if you want coffee or if you are tired or if you would like some rest. And you say, thank you mom, option B, both 1 and 2. That's where we all are right now. On a personal note, I had a fantastic time here, more outside college than inside. Quizzing took me into every nook and corner of the country, and along with it, I took Osmania. Not to mention, most famously on national television with Amitabh Bachchan on Kaun Banega Crorepati. We Osmanians were always known well in the medical field, but today, after 6 years of making the college proud, people have begun to see Osmania as a formidable force, even better than engineering, business and law colleges. It gives me great satisfaction to say that in the few years of being here, Osmania Medical College has featured on NDTV, CNN IBN, Sony TV, Times Now, CNBC TV 18, TV9, 4TV, Ruby TV and whatnot, and loads of newspapers several times. Most recently, the fame of Osmania flew even to Sweden through us, and the universities there welcomed us. My happiness knew no bounds when Ramani ma'am, our DME and former principal, told us a year or two that my brothers and my achievements helped the college ranking jump up in the national rankings. Pariplavi ma'am in particular has been a great mentor and a great friend for so many of us all throughout. Her constant presence and help every time we were stuck or confused guided us all through. And her baby, her brainchild, Osmicon, has been a trendsetter in the state. I've been fortunate to be a part of every Osmicon since the very beginning. When I look back, I often wonder about my schoolmates. They also wrote MSET with us. They took up engineering. They graduated while I was happy to pass my third year SPM internal. They got a job. Some even got their masters while I just joined internship. And then they even got married when I was contemplating a divorce with MBBS, having enough of it. And then they had kids, while I was delivering kids in my obstetrics postings in the last 2 months of internship. Well, I could see Einstein's time dilation in action right before my eyes. Friends, we can only have been maniacs and severely obsessive compulsive personalities to have been all through this, and yet love it from the core of our hearts. We would probably not have it any other way, don't you agree? We lost also some of our friends along the way, and those have been painful experiences. We realized how shocking or surprising life can be for some. Death can visit any of us any moment, and one can never be prepared for it. This alone should make us all think deeply about what best we can do with the few moments we have, the one unpredictable life that we have. So, believe this, 8 principals, 19 departments, dozens of HODs, and hundreds of professors later, we have come to the culmination of this extraordinary journey. So far, we have been memorizing more and thinking less. The time has come to think more and memorizing less. To think with our brains, but also with our hearts. To hold neutrality and compassion in the same breath. Between corporate hospitals, private practice, and government healthcare, medicine today is fighting a battle for its soul. And as we move out, we are the hope for how this battle will turn out. Fellow classmates, we sure today are medical graduates, but are we doctors? Think about it. We need to bridge that gap. And how many of you knew that the word doctor itself comes from Latin for to teach, docere, to teach. Every doctor must be a teacher. That's the easiest way we can contribute to our profession, like our wonderful teacher seated here. Society will now permit all of us to use drugs and instruments that can do great good and can also do great harm, and that in the hands of others can be weapons. With such great power comes great responsibility. The much coveted 2-letter prefix to our names is not a badge to flaunt about everywhere, every time, at every place, but it is a burden of responsibility to be carried out irrespective of time, place, and your situation, friends. A doctor once told me, patients do not put their trust in machines or tablets or devices. They put their trust in you. Never ever lose your moral compass. Along the way, surely you will feel worn down and hopelessness might take over. But resist. Osmania has shown us the best and the worst. We can be the toughest and most resilient about our principles. And we can be the softest and most humane of people. We often hear doctors, and in fact all of us, saying how hard we had to work to get here. Of course, we put in all that we could. But even the best isn't perfect. I'm sure our professors here will agree. Can there ever be a perfect doctor? Can one ever be 100% sure of the prognosis after doing the best for the patient? Well, this is where our profession brings us closest to the Almighty, brings us closer to our limitations, and brings us closer to the mystery and the mercy of God. We have all left deep imprints on each other's lives. All the people we met, all our relationships end here. But one relationship remains. The relationship with books. Jokes apart, a doctor is a student for life. So my dear friends, let go of any regrets, let go of any broken hopes. Enter the next phase of your life with the same excitement that you entered this one with. And my dearest parents, today we are getting a degree in our name, but in reality, it is a certification of your efforts, your sacrifices, and your dreams. All your deepest love, selfless affection, and angelic sacrifices can never be repaid. The lifelong desire to see your son or daughter as a doctor is today fulfilled. You deserve to be the happiest of all today. This is your day. A thunderous applause for these amazing men and women who are the real heroes for today. Friends, do we realize how many people out there would give anything they have to be in our shoes today? We all have so much, just so much to be thankful for. My dearest classmates, from here on, life will take us on different roads. Some will stay in the city, some will go back to their native places. Others will be scattered across the country, and yet others on the other side of the planet. But these 6 years, they will bind us forever. Today is when we assimilate all those feelings and memories, pack them into a beautiful little spot in our hearts, and seal them with the pain of nostalgia and the joy of having been so lucky to be a part of it. So someone in the future, when they see your nameplate or your bio and read out Osmania Medical College, you will reach out to this very spot in your hearts. Look at the beautiful faces, the memories, the experiences, and give yourself a big, wide, blissful smile that you were a part of this delightful journey. Will we ever have the amount of fun we had in these 6 years at Osmania? I doubt it. My dear friends, the only way we can do justice to what we have become because of this college is when somewhere, sometime in the future, a confused teenager looks up to us and says, well, I want to be like him or her. I want to be a doctor. I want to be an Osmanian. That, my friends, would be true payback to our noble profession, lovely teachers, and our entire college. It's been 2,128 days, dear friends. 3,064,300 minutes later, dear parents, we are finally all at the very end. Those dreams we grew up with, those hopes you parents had, the moment you all worked so hard to see your child reach, all of that converges today. Converges into this moment where we pause and look back at 6 years of fulfillment and look ahead at a life built on this foundation of these 6 years. Wishing you all the greatest of times, the best of times. And Mama and Daddy, I love you. You always wanted me to be here, and here I am. You are the reason I will continue to live. You are the reason I will continue to love. You are the reason I will continue to serve. Thank you all. Have a great life ahead.